Hi, this is Nancy Reed. I am recording a lecture for University of Lynchburg's Physician Assistant Study. This is the Ophthalmology series, and this is lecture on transient vision loss. It's part 10 of this lecture series, and we're going to talk about amaurosis fugae. This is a topic that is covered on the PANCE and PANRE exam, so we're going to talk about it briefly. So it's Latin for fleeting blindness. This is not a disease, but rather a sign of another disorder, and it's usually, the etiology is usually a blood clot or a plaque that blocks the flow of blood to the retina. This is a painless, transient, and complete or unilateral or bilateral blindness lasting for seconds to minutes. And it's described as a blind being pulled down over the eye. Risk factors for this are heart disease, especially irregular heartbeats such as atrial fibrillation, alcohol abuse, cocaine use, being diabetic, a family history of stroke, high blood pressure, high cholesterol, because you can be throwing cholesterol plaques up and it will cut off the blood supply to the eye. Increased aging, and smoking. People who smoke a pack a day double their risk of a stroke. Some related disorders are a brain tumor, a head injury, history of MS, history of systemic lupus erythematosus, migraines, optic neuritis, polyarteritis nodosa, and the treatment for this is just treat the underlying cause. So again, this isn't a condition in and of itself. It's a sign of probably a worse condition that needs workup. And we're going to do one last knowledge check from the last two sections, the posterior eye, in this section, amaurosis fugae. You have a 44-year-old myopic female presents complaining of painless, blurred vision with flashing lights and new floaters. The patient describes a curtain being lowered over her eye. And the most appropriate treatment for this patient is routine referral to ophthalmologist, routine referral to optometrist, immediate referral to ophthalmologist, immediate referral to neurologist. And the correct answer is immediate referral to ophthalmologist. She has a the beginning of a detached retina. And some risk factors for this are the fact that she has a myopic, and that means she has a longer eye, so there's more tension on the back of that retina. And remember, I talked to you about retinal specialists to get called in all the time in the middle of the night because these retinal detachments are immediate referrals, and the sooner you treat them, the less vision loss. Thank you guys so much for your patience. There will be a Zoom conference on Thursday from 3 until 5 p.m. I will just have an open Zoom conference, and you guys can drop in and ask any questions that you have in regards to this topic.